the scaphoid series, and the patient will be sitting here on the chair, and then we'll be using this cassette that's 18 by 24 centimeters. We'll be using it crosswise. And already I've cleaned my room. My tube is centered, and I have my chair. We have the lead down here. I have my markers to show which side we'll be doing. And then now I'm going to be calling my patient and then explain the procedure to them. Good morning, sir. My name is Vitaly, so I will be your radiographer for today. Can you please confirm your ID for me, your date of birth?
My date of birth is 2003, 12/20.
Okay, what's your second name? Do you have another name?
Yes, I do, but I don't like it so.
I will just
Okay,
have to.
sorry,
I have to ID.
it's speech.
Okay. Okay, sir. Which side is painful?
It's my right wrist.
Okay, sir. We're gonna have you seated on the chair. We're going to do two positions. The first one, you're gonna place your hand like this, and the second one, you're going to deviate it as much as you can towards your pinky.
Okay, I'll try.
Okay, can I ask, is this your first time being out to the X-ray department?
Yes, this is my first
Oh,
time.
okay. I'm gonna have to sit here, but first we're gonna have to give you this,
So what is that for?
It's a leg gown for radiation protection.
Perfect fit.
Okay, I'm gonna have to just sit this side, Can you please take off your watch for me?
My watch.
Yes.
This is my. It's my left watch. Why do I have to take it off?
I know, but then we have to take it off because it's an artifact.
Oh.
It's going to obscure some of the structures that the doctor needs to see. So I'm gonna need you to place your hand straight,
Okay.
I know it's painful, but I'm gonna need you to. Sorry. Don't move your forearm, I'm gonna need you to rotate your hand towards your pinky finger, as much as you can.
Okay.
That's right. Good. Okay. To expose for the second. Okay, so I'm going to need you to sit on that side because our machine has technical issues. Some of the buttons are not working. So for the last procedure, I'm going to need you to sit on this side. I need you to come a bit more. You can come forward with the chin. Okay.
After exposing, the following should be clearly shown. Evidence of proper collimation. No rotation of the wrist. Scaphoid with adjacent articular areas open. Maximum ulnar deviation. Soft tissue and bony trabecular detail. Evaluation criteria. Anatomy demonstrated. Scaphoid demonstrated clearly without foreshortening or overlap. Soft tissue and bony trabeculation of the scaphoid clearly demonstrated. No motion. Structures shown. This position reduces foreshortening of the scaphoid, which occurs with a perpendicular central ray. It also opens the spaces between adjacent carpals. Evaluation criteria. The following should be clearly shown. Evidence of proper collimation, distal radius and ulna, carpals and proximal half of metacarpals, scaphoid with adjacent articulations open. No rotation of wrist. Maximum ulnar deviation, as revealed by the angle formed between the longitudinal axis, the ulna, and the longitudinal axis of the fifth metacarpal, soft tissue and bony trabecular detail.